Hi, my name's Anne, and I have a respiratory condition that my GP has prescribed Respimat inhaler. I would like to give you a visual guide on the Respimat inhaler, the purpose, a small demonstration, how to clean it, store it, test it, and what to do when you're going to the clinic or hospital. But most important, I would recommend that you keep the instructions that go with the box as well. The Respimat inhaler is a inhaler to prevent flare-ups. It won't be effective if you wait until you have a flare-up, so you really need to take it every day. The Respimat inhaler is a metered dose inhaler, MDI for short, and it administers an aerosol dose to the lungs. This is a cap, this is the lid, this is the button that would release the dose. This is the arrows here, you can see red arrows that shows you the way you would turn to release it. And this is a dose indicator here. And this is a safety button. When you pick up your inhaler from the pharmacist, always check that it's within the use by date, usually at the bottom of the box. I'm going to insert the canister into the bottom of the inhaler. This is where the dose is. Give it a little push, and that's your bit, the way we see it just now. When I replace the bottom cap, the canister should still be protruding. Once I'm ready to take my dose, I'm going to give it a twist. And as you can see, the canister is more or less flush with the bottom of the inhaler. And that's the dose ready to take. When you use it for the first time, you need to prime it first. So you'll give it your first turn and back, open up the cap, move it away from yourself and release. This grey button will release the dose. You take your inhaler at the same time every day. I tend to take mine in the morning because my inhaler's in the bedside cabinet. You can take it with or without food, but when you do take it, you need to be standing or sitting in an upright position with your head facing forward. So you hold your inhaler upright and you give it a twist to ensure that the aerosol dose is in the inhaler, open. You expel your air from your lungs, and then as you're breathing in, you would put your mouth over the mouthpiece, but avoid, as I've said earlier, these two small air vents. If I can maybe put it aside, maybe you could see. So as I said, you breathe out all your air in your lungs and put your mouth sealed over the mouthpiece and breathe in. At the same time you're breathing in, press the grey button to release your dose. Then you hold for 10 seconds. I usually count with my fingers, and then breathe slowly out. When you've done that, you would close the cap, wait 30 seconds and repeat. I'm now going to show you how to use the inhaler. It's as easy as that. To clean your inhaler, it's always advisable to wipe it after use. What I've noticed is, after I use the inhaler, it's quite moist, this wee cap, so it's always better every time you use your inhaler to have a wee tissue and give it a wee wipe over. Clean it once a week with a nice clean cloth, damp cloth. Another point I would like to say is always brush your teeth after use. And that's why I always find when I take my inhaler, I take it in the morning next to my bedside cabinet, and then I automatically go and brush my teeth, and the same at night. If you don't, well, it can maybe cause a wee slight infection or hoarseness. I store my inhaler in my bedside cabinet. You need to keep it away from sunlight and frost. So it's best keeping it in a dark, dry cupboard or bedside cabinet. Taking your inhaler. As I say, you take it regular every day at the same time. Should you forget, if it's 1 or 2 hours, that's okay, you can take it. But if not, wait till the following morning again before you take it, or you could overdose. If you do, however, contact a health professional for advice. This is the dose indicator. So when it starts at green, you have 120 doses. When it gets the first part of the red, you have 30 doses left. And that's always advisable to order your prescription then. And order your inhalers only when you need them, because drugs can expire. Always remember, when you go to the hospital or clinic, to take medications and your inhalers with you, so the health professionals know what other drugs or medications you are on. Thank you.